What is a bowel regimen for children with constipation? Imagine a plan that helps your child's tummy feel better and keeps their bathroom visits regular and comfortable. That's what a bowel regimen for children with constipation is all about. It's a carefully designed routine that includes changes in what they eat, how they sit on the toilet, and sometimes medicine to help them go more easily. The main goal is to help children have 1-2 soft, easy-to-pass stools each day, which can prevent pain and the urge to hold in their stool. Holding in stool can make constipation worse, so establishing a good routine is very important. First, let's talk about what children eat. A balanced diet with enough fiber is key. For children, the recommended fiber intake is usually there age in years plus 5 grams each day. For example, a 5-year-old should aim for about 10 grams of fiber daily. Good sources include fruits like apples and pears, vegetables, and whole grains such as oats and brown rice. Drinking enough fluids is also essential. Younger children generally need about 4 to 6 cups of liquids daily, while older children may need up to 7 or 8 cups. For infants, small amounts of fruit juices like prune, apple, or pear juice can help soften stools and increase their frequency. But it's important not to give too much juice or extra fiber beyond what is recommended, as that doesn't always help and can sometimes cause other issues. Next, behavioral strategies can make a big difference. Setting regular times for your child to sit on the toilet, ideally 2 to 3 times a day, especially after meals, helps train their body to have regular bowel movements. Keep these sessions relaxed and positive, using praise or small rewards to encourage them. Creating a calm environment and teaching proper toileting posture, like sitting comfortably with feet supported, can make it easier for them to go. Sometimes, medicine is needed to help. The most common first choice is an osmotic laxative called polyethylene glycol 3350, often sold under brand names like Miralax. It works by drawing water into the colon, softening the stool and making it easier to pass. The dose is adjusted until the child has 1-2 soft stools each day. Stool softeners like Docusate can also be used, but they are usually less effective alone. If the constipation is severe or there is a blockage called fecal impaction, a healthcare provider might recommend a clean-out with higher doses of laxatives or a combination of stool softeners and stimulant laxatives like Senna or Bisacodyl. These stimulate the muscles in the colon to help move stool along. Once the stool is cleared, children often need ongoing treatment for several months or even longer. This long-term management helps prevent the problem from coming back. It's very important not to stop treatment too soon because constipation can become a cycle of painful bowel movements and stool withholding. Regular follow-up with a healthcare provider is essential to adjust the plan as needed and to check for any underlying causes. If constipation persists or becomes complicated, a specialist such as a pediatric gastroenterologist might be involved. In summary, a bowel regimen for children with constipation combines healthy eating, scheduled toilet times, and the appropriate use of laxatives, mainly polyethylene glycol. This approach is based on current medical guidelines and scientific evidence. Patience and consistency are key, as it can take months to fully resolve constipation. Always work closely with healthcare professionals to tailor the plan to your child's specific needs and ensure safe, effective care. Remember, every child is different, so personalized medical advice is always the best course of action.